Good evening, everyone. I'm Alyssa Armstrong, and I will be your moderator for this news conference. First, I'd like to introduce our speakers. We have City of Austin Mayor Steve Adler, Eric Carter, Chief Emergency Management Coordinator for Travis County, Juan Ortiz, Director of Homeland Security and Emergency Management for the City of Austin, and Stephanie Hayden, Public Health Director for the City of Austin. I will now pass things off to Mayor Adler, who will provide updates regarding Hurricane Laura.
Good evening, everybody. Boy, I tell you, calendar year 2020 is certainly the doozy. Once again, our community and our state and our neighbors all pulling together to help one another. We all have the watchful eye to look at the storm as it's hitting our coast. And at the same time, opening up our city to guests who are leaving what could be unsafe conditions and looking for a place to be able to shelter from the storm. Austin's doing its part. We're opening up our doors. We have been able to get over 1,000 hotel rooms available to over 3,000 guests. Coming up from the coast, more than we anticipated. So our resources at this point, hotels stretch kind of thin. We're urging folks as they're leaving and coming to Austin that if they want a hotel room, the easiest way might be to stay on the road just a little bit more, get up north toward Dallas, because there are a lot of hotel rooms that are available here in Texas. But for those folks that want to stay here and need help, don't have the resources for a hotel room, we are, and you'll hear about it in a second, opening up a more traditional shelter in our convention center, and you'll hear more about that for folks that want that. But I want the community to know that as in all things here in calendar year 2020, before and after, we're all in this together. We're all rolling up our sleeves and holding out our hands to welcome our neighbors, and Austin's going to do its part. So we have some folks here to talk to you today. Some of the folks from the Emergency Operation Command, Director Hayden from Austin Public Health to provide further details.
Okay, Eric, we can go ahead and get started with you if you'd like.
Well, sure. Thank you. And the mayor hit it on the head when he talked about just challenging times. We, of course, have been focused on our response to COVID, and it's presented challenges to the community that we've been facing and dealing with quite successfully going into the fall. And then, of course, when our citizens and are impacted, our neighbors, as happening with the hurricane, we've got to also stand up and respond and help support them. So that's what Travis County, in partnership with the City of Austin, and even beyond that, the other counties in our area have done to respond to the hurricane threatening Texas coast. So we've been working in partnership these last few days to get our community stood up and to open our arms and our hands and try to help those evacuees. It's important to call out and recognize the other counties that are pitching in. The Hayes County team and the Williamson County team have been active along with Travis County in partnership with the City of Austin to support all the evacuees coming into our area. As you know, the Travis County Judge Bisco recently, this morning, issued a disaster declaration for Travis County that allowed us to access of all of our emergency authorities so that we could do whatever we can to support the evacuees into our area, and that's important. Our goal is, of course, to be safe, to make sure folks are safe, That includes receiving them and then helping them if needed. Hopefully, just get a rest and again before they move out and seek shelter, whether it's on their own in an area hotel or with friends and family. We know most of the evacuees that are threatened by Hurricane Laura have done just that. They've sought shelter and have been successful in sheltering themselves with friends and family, whether here in San Antonio or up in North Texas. But for those who needed a little bit of help, that's what we wanted to do. We put tools in place and of course people in place to help those folks with sheltering needs, and that's it's been a challenge. But our area, not just locally but across the region, I think everybody has stood up to face the challenge in this new, of course, in the shadow of COVID, to provide that sheltering effort. So that's been our goal, and I think we've been working at it. So I'll stand ready for any questions that we may have, and I'll pass it over to Juan Ortiz.
Thank you, Eric. And like the mayor said, and Eric indicated as well, this is really a regional partnership and how to respond to what has proven to be a non-traditional year. And so therefore our hurricane shelter hub plan had to adapt from its traditional setting and be able to provide the level of service that that is necessary to respond to evacuations resulting from hurricanes. And we're not at the peak of the season yet. So this has proven to be a very challenging response, and has resulted in our teams to really work real hard to make sure that we meet all of the logistical needs and requirements, establishing early on the programs to identify the changes that we need to put in place. We established, and we are running a reception center for the first time, which is a deviation from our previous hurricanes, but that was necessary primarily largely because of the ongoing response to the COVID-19 pandemic that we have been dealing in our community and across the country and the world. Obviously, that introduces the new issues as we are trying to determine the number of evacuees that are coming, and then also continue to support the existing contracts that we have and agreements that we have with communities like the city of Galveston and Galveston County. And then also the fact that some of our regional partners also took on the challenge of supporting other communities. Hayes County took on the responsibility of supporting Brazoria County. And so it introduces the challenges that we're having to determine are those coastal communities going to evacuate or not? And if they are, we need to save the adequate shelter space for them. And if not, then we need to be able to support the rest of the entire region. So that has been a challenge. But like it was previously said, we're working real hard to meet the needs of everybody. And we have been able to support the evacuation of all the buses that came from the city of Galveston, and also been able to provide shelter space for the people that drove by themselves. In addition, several other people have been able to find shelter space in our communities that they have been able to secure with their own funding. We're working with the state of Texas very closely to ensure that we're coordinating with them and pass the information necessary for our residents our guests, in order to make the best decision to protect themselves and be able to meet their needs, and working to make sure that we give them the information necessary to what other places in the state of Texas they may be able to find adequate temporary sheltering, whether it's in a traditional setting or in the setting of a hotel as necessary because of COVID-19. We are working to also, like the mayor indicated, we made the decision to go ahead and open a section of the convention center in a traditional shelter setting with the assistance and the cooperation of the American Red Cross and the Texas Division of Emergency Management, in order to ensure that we are able to provide an adequate shelter that meets the concerns because of COVID, and make sure that we have that ready as soon as we possibly can, which at this point we're looking at later tonight or first thing in the morning. Those are the what we have been asked to do at the request of the state of Texas in order to ensure that we help our neighboring Texas neighbors along the Texas coastline.
Health and safety are number one for us here in Austin, Texas. At Austin Public Health, we are a partner in this response. We are going to ensure that our guests that come to town have their needs met. I know so many people are concerned about COVID-19 and our response. We are going to use information that we have received from FEMA as well as CDC to ensure that our screening and cleaning processes are in place. We are going to ensure that if individuals need a face covering, we're going to provide that for them in order for them to maintain the utmost health and safety in this setting. As we move along this process, we have started the process to look at our multi-agency resource center. If that turns into a need, we will be ready to stand that up. With this type of response, it is important for us that if an individual does develop any health needs, we are going to partner with others in the community, but we have also set up a medical shelter in this response. And that way we can address any needs that an individual may have. The goal is to work through these systems at the convention center and the medical shelter to address any medical needs that any of our guests have. Our goal is to truly be Texans and share in this responsibility. We have responded to several responses. We know that hurricane season is going to continue, and we're going to do everything we can do. This is a regional approach, and we do applaud Williamson County and Hayes for providing assistance to us. It is going to be all hands on deck for this response. And Austin Public Health is committed, along with the rest of the city and the county, in this response to ensure health and safety are number one. I will turn it back over to the pool reporter now.
Okay, so this is Jennifer at Fox 7 Austin News. I'm going to go through the questions. The first one is from Fox 7. Yesterday, the Office of Emergency Management said they were told to prepare for 3,000 evacuees. How many people have showed up at CODA's reception intake center?
As of this morning, we have provided 1,078 hotel rooms, and we are approximately providing the need to about 3,000 or a little bit over 3,000 guests that have evacuated either by bus or on their personal vehicles.
Okay, moving on to a question from Community Impact. What is the capacity of the convention center and how long could it be used as a shelter? Are other shelter options still being explored?
Well, in addition to the convention center, we continue to try to identify any additional hotel space that may be available so that we can provide it in the non-traditional setting, as well as provide information to evacuees so that they know where else they can go to find adequate sheltering. But the goal for the convention center is we're looking at trying to establish a shelter capacity of approximately 135 shelter spaces due to in order to ensure that we stay consistent with the recommendations from FEMA and the CDC as they relate to COVID.
From the Austin Chronicle, what's the best way for Austinites to help? Volunteering, donations, are specific skills needed? For example, healthcare workers, childcare, food prep.
At this time, we would just ask our Austinites to just kind of stand down right now. We really have to make an assessment of the needs that present. As we move along and as we discover any social service needs, we will address those through our multi-agency resource center. And so right now, we will just ask staff to stand down. If those needs become available, we will put them on our City of Austin and Travis County websites.
To add to that, Stephanie, if I may, that through the multi-agency resource center, the Austin Public Health team works with a number of volunteer agencies, and in the immediate term or time frame, they can work with the agencies like the American Red Cross or Austin Disaster Relief Network and a number of other agencies that collaborate with Austin Public Health in that arena to provide eventually support to people who have been impacted by disaster. So if they want to do a little reach out or to those folks to provide some form of monetary donations, that's never a bad thing, or provide offer to donate their time and assistance.
From CBS Austin, how many hotel rooms in Austin are available but not funded? And is the city considering funding additional rooms?
Obviously, there's a large number of hotels that are in our community. Currently, we have been able to contract with, like I said, 1,078 hotel rooms. We're still looking to see what additional blocks of rooms that are available. But there's a large number of hotels that have already been taken up directly by the guests or the evacuees from the Texas coast, and so those are still meeting the need of supporting the evacuees, but it's something that did not require the assistance from the city and the county, so allowing us to provide the assistance to those that had no ways of providing or securing a shelter during their evacuation.
This is a question from the Austin American-Statesman. How does the number of evacuees that have arrived in Austin compare to the numbers from Harvey or previous hurricanes? Has Austin exceeded capacity like this or this soon in the past?
Well, in the last 3 years, we have experienced two hurricanes in which we had to provide sheltering. In the last one, before this one, was Hurricane Harvey. The maximum number of evacuees that evacuated before and after landfall were approximately 850 evacuees that we provided support as our guests. To date, we are a little bit over 3,000 and during Hurricane Laura, and Hurricane Laura has not made landfall yet. So there may be an additional number of evacuees that we may need to be able to support, especially depending on where it makes landfall and what the impacts of the storm are going to be.
This is a question from KXAN. Can you provide the number of evacuees who were directed to isolation facilities in Austin? Have any evacuees been tested for COVID-19? Are there any positive or suspected positive cases among evacuees?
No evacuee has been directed to any isolation facility at this point in time. The evacuees that were transported by bus had temperatures checked before they boarded the bus in Galveston, and everybody that went through the reception center was assessed, temperature checks, and what we call medical and functional needs assessment. And because we are in a non-traditional shelter setting, we're able to put people in hotels where they are able to maintain social distancing a lot easier. And therefore, there has not been a need at this point in time to refer anybody to any type of isolation facility. We continue to work with our shelter managers to continue to monitor the conditions of our guests, and if they're starting exhibiting symptoms, then we will follow our normal traditional COVID protocols that we have already established in the community before this hurricane.
This is a question from Telemundo. Can you please provide the following answers to these questions in Spanish? How many more hotels are available and how many more evacuees are you planning to accommodate?
Sí, en este momento hemos podido mantener el número de hoteles, 1,078 hoteles que se han abierto para dar asistencia a las personas que están evacuando. En ese momento estamos siguiendo tratar de encontrar más hoteles. Para esas razones estamos viendo en qué otras partes del estado las personas que están evacuando y necesitan albergues, en qué comunidades las podemos dirigir para que puedan encontrar lugares donde se puedan evacuar, y también tratar de encontrar hoteles adicionales para poder cuidarlos aquí en nuestra área si es necesario.
This is from Teo Radio. If the convention center is used both to shelter and possibly treat evacuees, how will they be isolated, fed, and provided other basic services?
So can you repeat the question again?
Yes. If the convention center is used both to isolate and possibly treat evacuees, how will they be, sorry, hold on one second. If the convention center is used both to shelter and possibly treat evacuees, how will they be isolated, fed, and provided other basic services?
So the convention center, if it's utilized at this point in time, is only being planned to provide a traditional shelter setting environment. We have already established, like it was said by Director Stephanie Hayden, we have a medical shelter that would be available if we need to move somebody into that setting. And if that is not appropriate, then they would go to a medical facility like a hospital for treatment. In addition to that, we continue to utilize our existing isolation facility that we have available in our community that was established as part of our COVID response. And so if we need to isolate somebody that is being taken care of at the convention center, they would be moved to the isolation facility like that's available to anybody else in our community.
This is a question from the Austin Monitor. How many evacuees or evacuee families have been placed in hotels, and how many are waiting for space to open up or have been sent north to find shelter elsewhere?
Like I stated, right now we have 1,078 rooms supporting the evacuees, which equate to approximately around 3,000, a little bit over 3,000 evacuees. They came both by bus or by personal vehicles. And we continue to work with the evacuees that are coming and are reporting to our reception center to help them identify a proper shelter in a hotel setting, or help them find and the right information so they have the option of moving to communities where there may be additional hotels as necessary.
From Patch, was the convention center being eyed for potential shelters set up as a COVID-19 field hospital and have to be dismantled to accommodate evacuees?
The convention center, part of the convention center has been identified as an alternate care site, and that setup is still there, and it remains, and is not at this point is not being impacted by the plans to establish a traditional shelter in the other sections of the convention center, and we don't see an impact at this point in time.
From Univision, can one of the members make a statement in Spanish with the most important info that will include where people can reach for help and get info in Spanish?
Sí, bueno, muchas gracias. Lo más importante es de que la gente debe de saber de que estamos tratando de ayudar a todas las personas que están evacuando a resultado del huracán Laura. y hemos abierto un centro en CODA para poder para poder dar asistencia a las personas que están evacuando, sea una forma de encontrarles un lugar donde quedarse en un hotel o también darles información a ver a qué comunidades pueden seguir yendo hacia el norte para ver, para poder encontrar un albergue que sea apropiado para la necesidad de las personas que están evacuando. También estamos trabajando para abrir un centro de albergue tradicional en el centro de convención aquí en la ciudad y para poder darle asistencia a las personas que no pueden seguir viajando hacia el norte y tengan que quedarse y no han encontrado un lugar en un hotel donde se pueden quedar. Y eso lo estamos haciendo para, lo vamos a abrir muy pronto, aproximadamente más tarde en la noche o mañana en la mañana, para poder tener un albergue que les pueda dar asistencia a las personas que están evacuando de la área costal de Texas.
Okay, we're back to Fox 7 Austin. The Red Cross says that they can accommodate congregate shelters, but they need much more room than in the past so that people can be properly spaced out. How will that be handled at the convention center?
So the CDC and FEMA have established the spacing requirements for adequate shelters in a COVID environment. And that is going to have an impact on the number of spaces that we can provide from previous years. But we are working to make sure that we are able to maintain the adequate social distancing in order to protect our guests that require shelter space.
Okay, from the Chronicle, how should evacuees who aren't in designated shelters seek assistance if they need it?
The city of Austin has the austin.gov/help website that is available for everybody to go and seek additional information. There you'll be able to find information on the latest information on the storms and also places where you can get assistance, and then also a link for information where they may be able to apply for FEMA assistance if they have uninsured losses and have been impacted by the disaster.
From CBS Austin, how many people does the city expect in the convention center? Will COVID social distancing restrictions prevent it from being able to reach capacity? And how long will it be available to evacuees?
The convention center will be available as long as necessary to support the evacuees from Hurricane Laura. Our target goal is to establish a traditional shelter with a population of approximately 135, and we will work with state and federal agencies to ensure that we're meeting all the necessary requirements for an adequate shelter given this COVID environment that we live in today.
From the Austin American Statesman, how long will evacuees be allowed to remain at CODA to wait for more housing opportunities? And at what point will they be told to go to another city?
Now, CODA is not a shelter. CODA is a reception center. That's a place where people that are coming in from the coast can go to and seek information and find out what other places that are available to them as places where they can find shelter, get a little bit of rest, get some water, maybe some refreshments, and be able to get the right information for them to make the decisions that's best for them and their families. We're also working with those people that are pulling in there to see if we are able to place them in hotels as spaces identified, and if also be able to provide them information of where they can go to a shelter, like the shelter that we're going to be opening in the convention center, which is more of a traditional shelter environment, whether it be here in the city of Austin or in other communities around us or further up north, further inland away from the coast.
And from XAN, only 42% of Austin hotel rooms are full, according to the latest numbers from STR. What prevented the city from reaching partnerships with these hotels for additional rooms when there were so many available?
The city and the county and the surrounding counties are working with all of the hotel organizations to ensure that we find the adequate number of hotels. There are a large number of people that were able to find hotel space and be able to shelter themselves that did not require local government assistance. And the fact that we had a lot of space taken up is an example of the fact that a lot of people were able to find locations here in Austin and Central Texas. With that being said, it has been some challenging to be able to find the adequate block of rooms available that we are able to provide to our guests. And we continue to work to find additional space as it becomes available to us and we're able to contract for it.
From Telemundo, and they're asking for Spanish here if possible. How will the convention center be set up to serve as a shelter, and what's the capacity that you expect to be available for? Any important info our Spanish-speaking audience needs to know.
El centro de convención se va a utilizar para abrir un albergue para darle asistencia a las personas que estén evacuando de huracán Laura. Aproximadamente estamos pensando que podemos tener la capacidad de 135 personas que se pueden quedar en el albergue, en el centro de convención, y estar seguros que estamos siguiendo las reglas de FEMA y CDC para proteger a todas las personas que se encuentran en el albergue. También les vamos a estar dando información en otros lugares que las personas pueden viajar a encontrar otros albergues alrededor de nuestra área o en otras partes del estado de Texas.
From KOS Radio, are there any special provisions being made for family groups, those with infants, those with disabilities, those with medical conditions, or other special needs?
Typically, those type of arrangements do come through our social services branch. We will have those services available. If individuals will call 311, our staff can work with them through that space. Typically, when we've declared an emergency disaster, those are state level benefits, and our staff will work with the state in order to be able to provide those provisions.
And then this is the last question from the Austin Monitor. Is FEMA helping with this operation?
The Federal Emergency Management Agency and the Texas Division of Emergency Management are working closely with the city and the county and other communities in the Texas area to ensure that we're working to have the adequate response to protect the lives of the evacuees that are evacuating from the Hurricane Laura. A lot of the programs that we are putting in place are a part of the disaster assistance protective measures that have been made available through the disaster declaration process.
That's all the questions, Sarah.
I will now ask if any of our speakers have any final comments they would like to add.
Don't, just for the record, the city also entered. I signed the declaration as well. So one entered by both the city and the county that enables us to be able to access resources.
I'll just add as a final thought, what the mayor opened up with, we're all in this together. And we are, for all our partners across the region, including the state of Texas, including the federal government, it's been important, the helping hands that have come out to help the folks who needed help during this period. Again, our work isn't done. We'll be at this for the next few days, and hopefully we will be able to see the folks who are guests today safely return home to the coast. To that end, though, for whatever it takes, we're here for them. And of course, our prayers are going out to those folks on the coast who are actually taking the brunt of Hurricane Laura, or will take the brunt of the hurricane overnight, and we wish them well. Thank you.
Thank you.
I'd like to say that we all have family members, or we know of someone that lives in the Texas coast, and a lot of us are thinking of them, and a lot of us have opened our doors in our homes to take care of them during this period of time. And like we have, and now not just in this hurricane, but in other hurricanes that come in the past. And I think this is really amazing that in the middle of a pandemic, that we have been responding to as best as we can since back in February and March. We're shifting gears and responding to a major hurricane that is impacting the Texas coast. And when that's done, we're going to continue to be working on the adequate response for the pandemic, for the protection of our citizens, and whether they're here or whether they're visiting because they're having to evacuate due to a hurricane.
Health and safety continues to be number one for us. As we are moving through this process, we are definitely going to adhere to all of our health practices. We are going to work with our guests so they will have an understanding about how to be very safe in Austin, Texas. We are wanting to ensure that their needs are met, their social needs, as well as any physical or medical needs. We will work with our operations center to ensure that if individuals have any symptoms, that we quickly move them to isolate them from the convention center area and move them to our ISOFAC. Our goal is to ensure that families have everything they need. We are committed to ensuring everyone that comes here is safe. We applaud our Austinites because in times like this, our community sticks so very close together. And we're so fortunate that our Austinites are already thinking about ways that they can support. I chime in, as Eric Carter said earlier, we have Red Cross and Austin Disaster Relief Network are able to assist us during this time. If we determine there are other needs, we will make that information available. Thank you very much for your time.
I'll just conclude with just real proud to be on this with our emergency team here in the city. Eric and Juan standing up the Emergency Operation Command are just becoming well-honed emergency teams, leaders in the city with the succession of emergencies. Director Hayden moving from multiple public health emergencies and stresses all at the same time. But this is what these days call for, and Austin is stepping up to do our part to help keep everyone who lives here, as well as all Texans who need our help, as safe as we can make it happen. So thank you.